The number of total hospitalizations is 9,600. That is a lower number than yesterday, barely. It's basically flat. As I mentioned yesterday, the weekend reporting numbers tend to be a little erratic sometimes. We're not quite sure why. This whole reporting mechanism has just been in place a couple of months. First time ever, every hospital is reported every day to the state. But it's better than going up. You see the overall total hospitalizations is down. Change in intubations is down. That's good news. And the number of new hospitalizations is also down. This is an important number. This is how many people came in yesterday with a diagnosis of COVID into hospitals, or people who were technically in a hospital who were then diagnosed with COVID. But again, Sunday is a different day operationally for hospitals. But again, the number's down, so it is good news. This is always the worst number when we're going through the facts of the day, and it is not good news. Number of lives lost, 230, technically up from yesterday, even allowing for the Sunday reporting. But it is painful news for all New Yorkers, and we'll remember those families in our thoughts and prayers. There's no doubt that we're coming down the mountain. Only question is what trail we take, what path we take coming down the mountain. How fast does that decline continue? Does the decline continue? And that is purely a function of what we do. None of this is preordained. None of this is decided by any factor other than our own behavior. You tell me how well New Yorkers socially comply with distancing, et cetera, and I'll tell you what that infection rate is doing. It's that simple. And everything we have done thus far has worked, and that's why the number's coming down. But you tell me what we do today and tomorrow, and I'll tell you the infection rate in the next few days. What we've said from the beginning is the key is testing and tracing and isolating. It's very hard to do. It's easy to say. No one has ever done this before. We've never put this kind of testing regimen in place. Industry-wide, we've never had a tracing operation that's anywhere near this magnitude. We've never done isolation, quarantine. That's never happened before. But we do what we have to do, and this is what we have to do to monitor the infection rate and to control it. And that's what we're doing. We laid out a very specific reopening plan yesterday. We studied all the states' plans. We've studied reopening plans of countries around the world. We incorporated all the best practices. I think we probably have the most specific plan for metrics and measuring to make these decisions. And it's basically a mathematical formula if you look at that reopening plan. And I think that's the way we should do it and proceed. This is about following the data, learning the lessons, listening to the experts, following the science, and it's about being smart. Everybody's emotional. We're getting more emotional. There's more stress. There's more anxiety. There's more pressure on all of us. We want to get on with life. We want a paycheck. We want to make sure our job is there. But it's still a time to be smart, right? We don't act emotionally. We act based on logic and fact and science. That's how we make policy. But we have to remind ourselves every day because the pressure is to just respond to the emotion. And there's also no doubt that we're going through a devastating and costly moment in history. It's costly on every level, number of lives lost, the economic impact, the personal impact. Substance abuse has gone up, domestic violence has gone up, mental health issues have gone up. So we have paid a very high price for what we're going through. But the hope is that we learn from it and that we are the better for it, right? We endured the pain. Let's make sure we benefit from the gain. And this is also true, and people can understand this as a life lesson. You know, you get as old as I am, you go through some tough periods in life, and that's a fact. That is going to happen. You live life long enough, you will go through a difficult period. I've gone through more than my share. But you take those periods and you try to learn from them and you try to grow, right? That's the best you can do with it. What can you learn so when you move forward, you're the better for it? And we do that as a society also. That's the concept of build back better. We don't want to go through all of this and replace what was there before. Replacing what was there before is a starting point. We want to replace, but we want to improve, and we want to be better for this experience, and we want to build back better. We were smart enough to do that as a country, as a state after 9/11. We went through pain. We came back stronger. You could argue more united as a country, more united as a state, more aware of our vulnerabilities. And yes, greatest country on the planet, greatest state in the nation, is our opinion. But we were vulnerable to terrorist attacks. Okay, so we learned from it, and we got stronger, and we got better, and we've incorporated security into our life in a way that was unimaginable before 9/11. Hurricane Sandy, Superstorm Sandy, devastated thousands of lives. Billions of dollars in damage. We built back, and we built back better than we were before. We didn't replace what was. We improved almost everything that we learned during that time. Our housing construction is different. Our power grid is different. Our infrastructure is different. So you go through these situations, and you learn. And that's what we have to do here. We have to have a better public health system. We should never go through this again. What we went through with the hospitals, what we went through with PPE, staff shortages, that can never happen again. How we use telemedicine, we have to learn and we have to grow. It was vital to what we did here. We have to make sure we're better at it. Our public transportation system, we're learning. Tonight we're going to shut down the subways for the first time in history. Why? Because they have to be disinfected. Who ever heard of disinfecting a subway car? Well, now you learn. You have to disinfect subway cars. Figure out how to do it. So you can say to people who use the subways, don't worry, it's safe, right? That's a starting point for public transportation. And one of the areas we can really learn from is education. We've all been talking about teleeducation, virtual education, remote education. And there's a lot that can be done. You know, the old model of everybody goes and sits in a classroom, and the teacher is in front of that classroom and teaches that class, and you do that all across the city, all across the state, all these buildings, all these physical classrooms. Why, with all the technology you have? And we've been exploring different alternatives with technology, right? We have classrooms in this state that have technology where they're talking to students on Long Island with a teacher from Staten Island, with students from around the world participating with technology, hearing that one teacher. And if you look at the technology, it looks like all these different students are in one classroom. All right. Well, let's learn from that, and let's learn from this experience. We did a lot of remote learning. Frankly, we weren't prepared to do it. We didn't have advanced warning. But we did what we had to do, and the teachers and the education system did a great job. But there's more we can do. We're still working on providing some students with the technology, with the tablets, et cetera. Some teachers needed training and they weren't ready for it. Well, let's take this experience and really learn how we can do differently and better with our education system in terms of technology and virtual education, et cetera. And that's something we're actively working on through this process. So it's not about just reopening schools. When we are reopening schools, let's open a better school, and let's open a smarter education system. And I want to thank the Bill and Melinda Gates Foundation. We'll be working with them on this project. Bill Gates is a visionary in many ways, and his ideas and thoughts on technology and education he's spoken about for years, but I think we now have a moment in history where we can actually incorporate and advance those ideas, right? When does change come to a society? Because we all talk about change and advancement, but really we like control, right? And we like the status quo, and it's hard to change the status quo. But you get moments in history where people say, okay, I'm ready for change. I get it. I think this is one of those moments. And I think education, as well as other topics, is a topic where people will say, look, I've been reflecting, I've been thinking, I learned a lot. We all learned a lot about how vulnerable we are and how much we have to do. And let's start talking about really revolutionizing education. And it's about time. One point I want to make about reopening, not just in this state, but all across this nation. There's a conversation that is going on about reopening that we are not necessarily explicit about, but which is very important. There's a question that is being debated right under the surface, and the decisions we make on reopening are really profound decisions. And the fundamental question, which we're not articulating, is how much is a human life worth? How much do we think a human life is worth? There's a cost of staying closed, no doubt. Economic cost, personal cost. There's also a cost of reopening quickly. Either option has a cost. You stay closed, there's a cost. You reopen quickly, and there's a cost. The faster we reopen, the lower the economic cost, but the higher the human cost, because the more lives lost. That, my friends, is the decision we are really making. What is that balance? What is that trade-off? Because it is very real. If you now look at the projection models of how many lives will be lost, you'll notice they changed recently. Why did they change? And they went up dramatically. Why? Because now they're factoring in the reopening plans and the reopening schedules that states are announcing. The federal government's estimate, FEMA, has increased from 25,000 to 200,000 the number of daily cases by June. Think about that increase. The IHME, which is a foundation model supported by Gates, which is the preferred model by the White House, when they were projecting deaths by August 4th, they projected in early April 60,000 deaths. They projected mid-April 60,300 deaths, actually a little lower. Their new projection is 134,000 deaths. How did it go from 60,000 deaths to 134,000 deaths? This is the model which the White House relies on. When the director of the institute was asked why those revisions happened, the director said rising mobility in most U.S. states, as well as the easing of social distancing measures expected in 31 states by May 11th, indicating that growing contacts among people will promote transmission of the coronavirus. That's a very nice way of saying when you accelerate the reopening, you will have more people coming in contact with other people. You're relaxing social distancing. The more people in contact with other people, the higher the infection rate of the spread of the virus. The more people who get infected, the more people die. We know that. And that's why the projection models are going up. There's a cost of staying closed. There's also a cost of reopening quickly. That is the hard truth that we are all dealing with. And let's be honest about it. And let's be open about it. And let's not camouflage the actual terms of the discussion that we're having. And the question comes back to, how much is a human life worth? You see that projection model go from 25 to 200,000 cases from FEMA. You see the number of deaths go from 60,000 to 134,000. How much is a human life worth? That's the real discussion that no one is admitting openly or freely, but we should. To me, I say cost of a human life is priceless, period. Our reopening plan doesn't have a trade-off. Our reopening plan says you monitor the data, you monitor the transmission rate, you monitor the hospitalization rate, you monitor the death rate. If it goes up, you have a quote-unquote circuit breaker. You stop. You close the valve on reopening. But it is a conversation that we should have openly. Hard conversation, painful conversation, controversial conversation, yes, all of the above. But it's also the right conversation, because those are the decisions we're making. Also, as we're going through this, it's important that our leadership be factual and productive and united, because this is a time when government has to work, and government on all levels has to work, and the federal government has to work, and it has to work now better than it has worked in the past. You know, all the craziness that we've watched in Washington, all the politics that we've seen in Washington, all the dysfunction that we've seen in Washington, now it is unacceptable. Because what government does today will literally determine how many people live and how many die. And that's not hyperbolic, and that's not overly dramatic. That is just a fact. That federal government has to be able to pass legislation. To pass legislation, it has to be on a bipartisan basis. You have the Congress, the House is controlled by Democrats, the Senate is controlled by Republicans. Unless you get a bipartisan agreement, you're not going to pass legislation. If you don't pass legislation, the federal government does not work. If the federal government doesn't work, it makes it virtually impossible for state governments to work. If I can't work, then local governments can't work. This is not something that a state can control. Well, the governors are in charge, governors are in charge. I can only be in charge to the extent I have the resources and the means. And that comes from the federal government. Not just for New York, but for every state in this country. So that federal government has to work. And the legislation that they pass is important. And they have to pass legislation. And that only happens on a bipartisan basis. There is no choice. Well, just the Democrats can do it. Well, just the Republicans can do it. They cannot. It takes two to tango. It takes two houses to pass a bill. And one is Democratic and one is Republican. So the facts are important. The President gave an interview, as reported in the New York Post. Blue state coronavirus bailouts are unfair to Republicans. Bailouts. This is the topic of whether or not the federal government should provide aid to state governments. And it's been a discussion for weeks. Federal government has passed legislation in the past that helped airlines, helped small businesses, helped hotels. Great, great. They haven't provided any aid to state and local governments. Well, why is that important? It's the state and local governments that fund police, fire, education, teachers, healthcare workers. If you starve the states, how do you expect the states to be able to fund this entire reopening plan? Well, the governors are in charge. But the states are in dire financial circumstances because our economy suffered when all the businesses shut down. So the debate now is, well, it's the blue states that have the coronavirus. Okay, New York they call a blue state. California they call a blue state. And the Republicans are saying, we don't want to give money to the blue states. First of all, this is not a blue state issue. Every state has coronavirus cases. And it's not just Democratic states that have an economic shortfall. Republican states have an economic shortfall. Well, it's the mismanagement of blue states for decades that they now want us to bail out. That's just not a fact. It is not a fact. First of all, no blue state was asking for a bailout before this coronavirus. I wasn't asking for anything from the federal government before the coronavirus. And by the way, the federal government wasn't giving New York anything for years. Everything they were doing was negative to New York. Then comes the coronavirus. Our economy stops because we shut it down. Now we have a $13 billion deficit because we stopped the economy. So what we're asking, every state is asking, because of the coronavirus, we need financial help in restarting the economy. And that's what we're asking for from the federal government. How do you call that a bailout, which is such a loaded word, such a rhetorical, hyperbolic word? It's a bailout. There's no bailout. Because of the coronavirus, this nation has been impacted and states have been impacted because the states make up the nation. And we need financial help because of the coronavirus situation. And this is not any mismanagement by the states. If anything, the mismanagement has been on behalf of the federal government. And that's where the mismanagement has gone back decades. Senator Moynihan, God rest his soul, New York senator, great man, said decades ago that New York has been continually shortchanged by the federal government. Why? Because we have always given them more money than they gave us back. Right? How does the federal government work? The federal government collects taxes and puts it all in a pot, and then takes money from that federal pot and gives it back to the states. Every year, New York State has put more money into that federal pot than the federal government has given back. Every year for decades. And that is just a fact. Also, you want to try to divide. The facts are, it's the Democratic states, which happen to have now high coronavirus content, which actually have put in more money than the Republican states who are now saying, why should we bail out the Democratic states? The Democratic states have been supporting them for years. New York, every year, $29 billion more paid in than it gets out. New Jersey, also a high coronavirus state, $18 billion more every year than it gives out. Massachusetts, Connecticut, California. And then you look at the Republicans who now say, well, we don't want to help the Democratic states. They are actually the states that have been taking more every year. Virginia, Maryland, Kentucky. Senator Mitch McConnell, he's Kentucky, $37 billion more every year. Alabama, Florida. Everything's about Florida. Why? Because it's a swing state, and we're in an election year. I get it. Florida gets $30 billion more every year than it puts in. What are you talking about? Fairness, equity, bailout. You look at where we've been over the past 5 years, we paid in $116 billion more than we gave back. You want to be fair, just give New York back the money you took, and it'd be $116 billion. Who gives and who takes? We know those facts and we know the numbers. But look, this whole discussion that Senator McConnell is raising, that some senators are raising, this is counterproductive, and it will lead to defeat for all of us. You need a bipartisan bill to pass. You go down this path of partisanship and politics, you will never pass a bill. And if you never pass legislation, you'll never get this economy back on its feet. So you go down this path of division, you will defeat all of us because we're all in the same boat. There is no separating us. It's still the United States of America. And this partisanship, we have to turn the page. I know it's how Washington operates. I know it's how Washington has been operating for many years. But we have to stop, and we have to change. And you do need a totally different mindset. It can't be, it's you versus me. It has to be we, right? We the people. If you don't get back to we, and you think about a collective interest, you're going to defeat us all. Because it can't happen. And you have to get out of this Democrat, Republican, it's red or blue. It's not red or blue. It's red, white, and blue. This coronavirus doesn't pick Democrats or Republicans. It doesn't kill Democrats or Republicans. It kills Americans. The virus is less discriminating and more of an equalizer than the lens that we're viewing the virus through. And if we can't get past this now, when can we ever get past it? You have a national crisis. You have a national outbreak, a national epidemic, killing thousands of people. You can't put your politics aside even now, even today. Families have fights. Yes, families have fights. Somebody's going to die. And the family is still going to carry forward these silly fights from years ago. Nobody even remembers how they started. If there's ever a time to come together, it's at a moment of crisis. And this is a moment of crisis. And we always understood, and the great ones always told us, that it won't work this way. A house divided against itself cannot stand. You want to be a leader? You want to go down in the history books as someone who stood up and did the right thing? Well, then remember what made us great in the first place. And that's what a great leader would do. Also, last point, each of us must do our part. Talk about government, government, government. Yeah, government has a lot to do. I understand that fully. Citizens also have a role to play. You know who's going to keep yourself? You're going to keep yourself safe. You know who's going to keep your family safe? You're going to keep your family safe. And you know who's going to keep each other safe? Each one of us keeps the other safe. Every person has a responsibility here, social responsibility. And that's what wearing a mask is all about. Just wear a mask. It's the smart thing to do. It's also the right thing to do, right thing to do. In all this complexity, there is still a right thing. You still know what's the right thing to do and the wrong thing to do. Maybe right thing is a New York expression. I don't think so. You know what the right thing to do is. Nobody has to tell you what the right thing to do is. The right thing to do is to wear a mask. Because it's not about you. It's about my health. You wear a mask to protect me. I wear a mask to protect you. And wearing a mask is not the greatest intrusion. I do not understand why people think it's such a burden to wear a mask. And look, 99% of the people do it. It's the 1% of the people who don't do it, right? That's who we're talking about. And we were talking about this last night, and I was expressing my frustration why some people just don't get it. And what this has been about from day one, this whole exercise, and where I started this on day one, all these things we've done, nobody's doing these things because government told them to do it, right? I'm the first governor in the history of the state of New York to say we're closing businesses, to say you must be quarantined. No governor has ever said that. How do I enforce that? I can't. I can't. How do you enforce making 19 million people stay at home? I can't. I said from day one, I can give the facts to New Yorkers, but then New Yorkers have to decide and agree that it makes sense given the facts and agree to do it. And New Yorkers have agreed to do it. All of these things. Closing schools, closing businesses, stay at home, socially distancing. So now wear a mask. And I was saying last night, I don't understand why this wear a mask is so hard. Mariah suggested it may be the way I'm communicating it. I'm just not effectively communicating. Don't laugh. Well, first of all, this is a common refrain in my house from my daughters, that it's me and my lack of ability to communicate effectively. It's a fair statement. And I'm guilty. I have no doubt I am guilty. I am a bad communicator. And that I haven't been communicating the rationale for wearing a mask effectively. So I'm open-minded. I understand my weaknesses and my flaws. I'm a work in progress. We're all a work in progress. I'm trying to get better. So Mariah's suggestion is, look, why don't we ask New Yorkers to produce an ad that the state could run on explaining to New Yorkers why they should wear a mask. And the context and the rationale and the health reasons and the social responsibility, and it's not that big a deal. Maybe there's a better way to communicate it than I have been communicating it. Again, 99% of the people are doing it, and it's great. We're talking about that 1%. So maybe I just haven't been persuasive or effective enough in my communication skills. So I said to Mariah, great idea. We'll ask New Yorkers, produce an ad, 30-second ad. They submit it. Mariah's going to be an unofficial advisor with the Department of Health. Pick the 5 best, put them online, let New Yorkers pick the best ad. State will run that ad. It'll say on the bottom, produced by whoever won the competition. They'll get a lot of acclaim. They'll go on to be big creative experts. And maybe we'll have an ad that communicates this better than I have been able to communicate it to date. So I'm excited about that. And Mariah is going to help on that and take it on as a project. And I'm excited about that. At no cost to the people of the state of New York, she will be a volunteer. The boyfriend can try to put in, he could submit a possible ad for consideration. the boyfriend will lose, but he could submit an ad, because I'm still governor. And that's what we're going to do. Mariah, do you want to add anything, or did I explain it clearly in my flawed communication modality?
No, I think you covered it. We'll be providing more information in the next few days, but if you are interested, you can go to wearamask.ny.gov.
Melissa, anything else on
No,
that?
perfect.
See, sometimes I communicate. Sometimes I communicate effectively. But you're not alone in criticizing my communication skills. Many of the people in this room would agree with you. And we are New York tough, smart, united, disciplined, and loving. Questions?
Governor, can you?
All right, New York State Governor Andrew Cuomo providing his daily update on COVID-19 happening in New York City and across New York State. Thanks so much for joining us here on WNY News Now for special coverage of this event. Coming up in just a minute, our News Now at Noon show with a look at some local reaction from COVID-19. Now the number of those who have recovered continues to rise. Plus, coming up on the broadcast, the effort to reopen New York State, what the future for that will look like. Right here on Facebook Live and on our 24-hour streaming network. On Facebook, all you got to do is refresh your tab and you'll see our new live video if you're watching on Apple TV, Roku, or on our mobile app and website. Stay right here.